The private sector has a major role to play in the healthcare delivery system in our country. To achieve the goal of universal health coverage, both healthcare providers have a key role to play to improve the health of our people. In the rural areas, the major healthcare provider are the private players. To go forward, to have a uniform healthcare system for the entire country, we need to have a system of an excellent government-private partnership.
Dr. Renjen, if this synergy between the private sector and the public sector in healthcare has to increase, then we also need greater number of professionals, healthcare professionals. And we all know about the ratio of a doctor in terms of per thousand in India. That's abysmally low. How do you think this challenge can be addressed? Because if we take the case of nurses, for example, the number of nurses that were graduating from India 3 years back was much higher than it is now because of some reasons, some rules. How can we address this challenge in your opinion?
Good morning, everybody. It's really nice to be here, and especially nice sitting with Dr. Paul to talk about a very, very important topic which we have come to discuss here today. And how do we take it forwards? Basically, as Dr. Paul very rightly said, the private sector has a major role to play in the healthcare delivery system in our country. We all are aware that the private and public healthcare providers function as two entities working together towards health for all. While public hospitals run under national and state hospitals, the private sector has to work its operational viability in a very competitive market. Over 70% of healthcare services in India are provided by the private provider. To achieve the goal of universal health coverage, both healthcare providers have a key role to play to improve the health of our people. The Government of India has been very nice and kind to increase public-private partnership modeled during COVID-19 response and also in the last two budgets. Nevertheless, there continues to be a perception that private hospitals are against public interest and operate only for profit and not transparent about the cost, which may not be essentially true. Or hospital treatment and packages are ununiformly priced. Therefore, it becomes very important for us to evaluate that what the private part have to do to provide excellent health care to our people at a cost which is affordable to our people. In our country, now to answer the question which I was asked specifically, in our country, where there is a gap between doctors, rural and urban, providers of health in rural and urban, there is a gap. There is a gap of the number of doctors who are there to look after. There is a gap in the healthcare provider. When I was going through this, I was shocked to see, I was shocked to learn for myself, that in the rural areas, the major healthcare provider are the private players. May not be that much so in the urban population. So I think to go forward, to have a uniform healthcare system for the entire country, we need to have a system of an excellent government-private partnership to see that every individual in this country gets the best healthcare available anywhere in the world.